Hello, welcome to Veterinary 101's channel. Today we're going to be talking about paraphimosis and what you can do in an emergency first aid scenario and how it is treated in a veterinary setting. What is paraphimosis? Paraphimosis is when a dog becomes unable to retract its own penis. It is quite common within juvenile dogs that are just becoming sexually mature, and it is often caused by excessive licking, a foreign body being stuck under or inside the skin, sexual arousal, and neurological illnesses. The equipment needed for the first aid and veterinary care for paraphimosis includes tweezers, which are good for precision and quite simple to use, however they can cause pain and injury if used carelessly. A lead, good for basic restraint and restricting movement, but are not the most effective physical restraints. Gloves, good for keeping areas sterile, reducing cross-contamination, but do reduce the effectiveness of using hands during procedures due to the lack of sensation they cause in the hands of a veterinarian. First aid. First aid. In this scenario, there is a dog suffering with paraphimosis. Because of this, 20 minutes should pass before any intervention is made. This is because the penis can take up to 20 minutes to retract by itself after arousal. If 20 minutes has passed and the dog's penis still has not retracted fully, then Dr. ABC should be done to assess whether there are any other medical illnesses or injuries that could be more severe or life-threatening that should be taken care of first. If there are no signs of difficulty breathing, lack of circulation, or the airways are blocked, then the next step is to examine the penis. The dog can be restrained using a lead if you are alone. Keeping the head away from the area, ideally, there will be another person to restrain the dog using 2 arms, controlling the head, the abdomen and the legs to allow for an in-depth examination to take place. Checking the penis for foreign bodies, blood or soreness that could be causing the paraphimosis. Putting a bag of frozen peas with a blanket or towel covering them on the penis will relieve some of the swelling and reduce the blood flow to that area. The peas need to be covered, else it could cause cold burns and sores. Following this, if the penis has still not retracted, the dog should be taken to the veterinary practice. While travelling, the dog should be in a crate, wearing a cone or wearing a lead to restrain it and prevent the dog from licking it, which could cause further swelling and irritation. Pre, post and peri-operative care. Scenario 2, veterinary care. When the dog arrives at the veterinary practice, the veterinarian will ask the clients to sign a consent form and pay any upfront costs. After this, the veterinarian will do a triage to assess what patients need to receive treatment before this dog does. The veterinarian will also perform Dr. ABC. This will assess whether there are any life-threatening illnesses or injuries that could make the dog deteriorate. The dog will be sedated so that the veterinarian can examine the penis properly using sterile tweezers to look for any foreign bodies on the skin of the penis that could be causing this case of paraphimosis. Tweezers work well for this because they are precise and easy to use, however they can cause pain and injury if used incorrectly. Sedation will decrease the blood flow to the penis, which in turn decreases the swelling of it. After the sedation, the veterinarian will make a mixture of sugar paste, which will be put onto the penis to draw out any moisture and reduce swelling. This is done via diffusion or osmosis. The veterinarian can also use frozen peas. These can be wrapped in a cloth and placed on the penis gently to reduce blood flow. Once the penis has retracted back into the shaft, the veterinarian will advise the client to put a buster collar on the dog. This is because the penis may be sore for a few days and can encourage the dog to lick it, potentially causing the issue to come back. The veterinarian can also advise the client to keep the dog's penis well lubricated. This can prevent the penis from getting stuck. As well as this, the veterinarian can recommend the dog wearing a cone or attending behavioural classes for a period of time to stop chronic licking. This can be done using reinforcement training. If this issue occurs frequently for this dog, the veterinarian may consider surgery to remove part of the shaft and to stop the penis getting stuck again.